Licensing and permitting may seem overwhelming at first, but compared to leasing and construction, this is actually the easiest part of launching your pharmacy. Why? Because the rules are already written and the path to compliance is clearly outlined by regulatory bodies. There is no guesswork involved, just a structured process to follow. Think of it as a checklist. The biggest challenge is finding time to sit down and carefully go through the manuals, laws, and requirements. But once you understand the roadmap, it is simply a matter of taking each step in order, making sure every form is complete, every fee is paid, every document is submitted carefully, and every process is followed to the T to avoid delays. The key here is patience and attention to detail. Now, let's break down exactly what you will need to get your pharmacy licensed and permitted. By the end of this lesson, you will have a clear understanding of the licensing and permitting process for your pharmacy. We will start by identifying the key licenses you need to operate legally, then break down which regulatory bodies oversee them and why they are essential for compliance. We will also go over the costs involved, including application and renewal fees, so you can budget accordingly. But keep in mind, licensing and permitting requirements aren't static. Regulations evolve, and staying compliant means staying informed. This lesson will give you a strong foundation, but it is important to do your own research to ensure you are always meeting the latest requirements. Let's get started. Each state has its own requirements for registering a business, so if you are a participant from outside Florida, be sure to research the specific regulations in your state. It is also important to understand how to maintain active status to keep your pharmacy business in good standing. In this section, we will focus on the registration process for pharmacists launching a pharmacy in Florida. However, please note that this course does not provide legal advice. It is the participant's responsibility to seek out any information not covered to ensure full compliance and a successful pharmacy launch. Launching a pharmacy in Florida requires several key business registrations. You will need to register with the Division of Corporations, obtain an employer identification number from the IRS, and secure a Florida annual resale certificate for sales tax if you plan to sell over the counter products. Before finalizing your business name, make sure it is available, not trademarked, and aligns with your brand identity. If you ever need to change the name of your business, it can be a tedious process. You must update it with the state where your business is registered, the IRS to obtain a new EIN, and the banks holding your accounts. First, you must change your name with the state, which can take time. In Florida, you can file the request online, which can take weeks, or you can visit the Division of Corporations in Tallahassee during business hours to expedite the process. Once your articles of incorporation reflect the new name, you can email or fax a request to the IRS for a new EIN. This step can also take weeks, but it is necessary before most banks will officially update your account name. Alternatively, you can wait to make the change during your next annual income tax filing. After your state registration reflects the new name and you receive an EIN from the IRS reflecting the change, you can update the name on your business bank accounts. Until all of this is completed, you may face challenges obtaining credit or completing essential banking transactions for your business. I know because I experienced this firsthand when rebranding to Privé Care RX. It was exhausting. Additionally, you will need to file quarterly sales and use tax returns, Form DR-15, and submit an annual report to keep your business in compliance. When it comes to banking, I highly recommend opening two business accounts, one for daily operations and another to set aside funds for taxes and unexpected expenses. This helps keep your finances organized and ensures you are always prepared for quarterly tax payments. Additionally, to operate a pharmacy, you will need several key licenses and registrations from different regulatory agencies. First, the community pharmacy permit from the Department of Health is essential. It is your official license to dispense medications in Florida. If your pharmacy will handle controlled substances, you will also need a DEA license from the Drug Enforcement Agency. Next, the National Provider Identifier, or NPI, from CMS, the Centers for Medicare and Medicaid Services, is required for billing and insurance claims. Similarly, NCPDP, the National Council for Prescription Drug Programs number, is necessary for processing electronic prescriptions and working with insurance companies. If you plan to accept online payments or work with major healthcare networks, you may also need an NABP merchant accreditation from the National Association of Boards of Pharmacy. On the logistics side, the Global Location Number, or GLN, from GS1 and the HIN Health Industry Number from the Health Industry Business Communications Council help with supply chain operations, vendor transactions, and ordering medications. Finally, don't forget your city, county, and state permits, such as a local business tax receipt and certificates of use, to stay compliant with local regulations. Each permit plays a role in ensuring your pharmacy is legally and operationally ready to serve patients. Now let's discuss the community pharmacy permit. Your application must be submitted, approved, and include all required documents and fees. Sections 465.018 and 465.0181 of the Florida statutes outline the full requirements, so please review them carefully and keep copies of all submissions. A community pharmacy must operate in Florida at least 20 hours per week unless reduced hours are approved. It must also have a prescription department manager, or a PDM, a licensed pharmacist responsible for compliance, record keeping, and security. A Florida pharmacist can only serve as PDM for one pharmacy at a time. The PDM must maintain a policy and procedure manual for inspections. If dispensing Schedule 2 or 3 controlled substances, this must be included on the application. Applicants must also submit a certificate of good standing or articles of incorporation from the Division of Corporations and complete background screening and fingerprinting for approval. Meeting these requirements ensures a smooth application process. The requirements and process for obtaining a community pharmacy permit with the Department of Health in Florida can change, so always check for updates. If you have questions, contact your state's Department of Health directly. The application fee in 2025 is $255, and the permit is valid for 2 years. The application must include original signatures from the owners, officers, and prescription department manager, along with policies to prevent fraud, fingerprints for all owners, officers, and PDMs, and corporate documents if applicable. You should submit the completed application and fee to the department and fingerprints through a live scan vendor. The board will review the application within 30 days, and if everything is complete, an inspector will contact you to schedule an inspection. After passing the inspection, your permit number is issued within 7 to 10 days, and the license is mailed within another 7 days. The full process can take several weeks, depending on application completeness, inspection scheduling, and any delays. Plan for at least 2 weeks after inspection to receive your permit and license. Here are key resources for your community pharmacy permit application and information. You will want to refer to the Florida Board of Pharmacy Division of Medical Quality Assurance and use the Community Pharmacy Inspection Form as a guide. Be sure to review Chapter 64B16 of the Florida Administrative Code, along with Chapters 456, 465, 120, 499, and 893 of the Florida statutes to fully understand the legal requirements. Additionally, the Florida Pharmacy Association offers valuable insights and support, and there are other important resources available to help you through the process. These documents and organizations are essential for ensuring your application is complete and that your pharmacy is compliant. To ensure compliance, every pharmacy must establish a policy and procedures manual. This manual should clearly outline several key areas, including the supervision responsibilities of the pharmacist, qualifications and training requirements for pharmacy technicians, and descriptions of delegable tasks like prescription processing, inventory control, and maintaining patient confidentiality. Additionally, the manual should include a continuous quality improvement program to regularly assess and improve operations. The pharmacy must also document that pharmacy technicians have reviewed the manual and received proper training in all outlined tasks. This documentation must be maintained and available for inspection to ensure compliance during audits. Additionally, the prescription department manager of record is responsible for determining the appropriate pharmacist to technician ratio based on the pharmacy's needs. This judgment is independent and cannot be overridden by anyone else in the pharmacy. Rule 64B16 27.410 provides a table of contents which you can use as a guide to easily customize policies and procedures for your pharmacy, helping you save costs. Remember, do not buy pre made policies and procedures. Instead, create your own to suit your specific needs. Barnes& and Noble will bind your policy and procedure manual professionally, and you can send digital copies to your team using platforms like DocuSign. Every pharmacy that dispenses a controlled substance must be registered with the DEA. Additionally, a state license must be obtained. To register as a new pharmacy, DEA Form 224 must be completed. The cost of the application fee is indicated on the application form. Once approved, the pharmacy will receive the Certificate of Registration, DEA Form 223, which must be maintained at the registered location and available for inspection. The DEA Form 224 should be completed online. If a duplicate certificate of registration is needed, it can be requested online or by contacting DEA headquarters. In 2023, the application fee for a DEA license was $888. To apply, a pharmacy must have a state license, a tax ID, and a business address, which may be subject to change. Once submitted, the application undergoes an initial review by a registration specialist before moving to a supervisor for approval. It is then forwarded to a DEA inspector for final evaluation. If the pharmacy successfully passes the inspection, the license is granted. The processing time can vary based on location, application volume, seasonal delays, and the availability of active inspectors in the field. For sure, you can expect processing delays at Christmas, at the start of the new year, and on federal holidays. I know this firsthand. Also, be sure to triple check your application for errors, as mistakes could significantly delay your pharmacy's registration. A pharmacist manual has been prepared by the Drug Enforcement Administration's Diversion Control Division as a guide to help pharmacists understand the Federal Controlled Substances Act and its implementing regulations. This manual provides essential information on compliance requirements, record keeping, and the legal responsibilities of pharmacists while handling controlled substances within their practice. The Federal Register is the official journal of the United States federal government containing government agency rules, proposed rules, and public notices. It is published every weekday except on federal holidays and serves as a critical resource for staying informed about regulatory updates and legal changes affecting the pharmacy profession. The National Provider Identifier is a unique 10-digit identifier assigned to healthcare providers by the Centers for Medicare and Medicaid Services. Many pharmacists already have an NPI. It is used in HIPAA related transactions, serving as a standard identifier for healthcare providers in electronic transactions such as claims, encounter information, and eligibility inquiries as required by the Health Insurance Portability and Accountability Act, better known as HIPAA. The National Plan and Provider Enumeration System, NPPES, assigns National Provider Identifiers, NPIs, to healthcare providers. Obtaining an NPI is free of charge and requires submitting personal and professional details, including your legal name, social security number, or employer identification number, EIN, date and country of birth, state of birth, if applicable, gender, mailing address, practice location, and phone number, and state license information. This information ensures you are uniquely identified as a healthcare provider. For fastest processing, it is recommended to apply online through NPPES. While processing times may vary, using the web based application system typically results in quicker issuance of your NPI. The NCPDP Provider ID, formerly the NABP number, was developed over 40 years ago as a unique national identifier for pharmacies to facilitate interactions between payers and claim processors. It is a 7-digit number assigned to every licensed pharmacy in the US. Even though pharmacies now use the NPI for billing, maintaining accurate NCPDP provider ID records is essential. CMS requires Medicare Part D plans to send pharmacy drug event data from claims, which is verified against the NCPDP online database. Many payers and third parties contracting entities still use NCPDP provider IDs to identify pharmacies and crosswalk between the MPI and NCPDP provider ID for accurate processing. The NCPDP provider identification number costs approximately $400 and must be renewed annually. Pharmacies can also expect the processing time for the application to take up to 5 business days. To apply for the NCPDP provider ID, pharmacies must provide certain documentation, including state pharmacy license information, DEA registration information, federal tax ID numbers, and an NPI confirmation. Healthcare Merchant Accreditation is an annual process designed to ensure that merchants are properly licensed and adhere to applicable laws and business best practices. This accreditation is crucial for ensuring that the merchant's operations are compliant with healthcare regulations, promoting trust and integrity within the healthcare industry. It is often required for pharmacies that accept major credit cards. Once your organization receives accreditation, it will be added to the list of accredited healthcare merchants. This helps distinguish your organization as one that meets industry standards and is committed to maintaining high quality practices. Pharmacy seeking accreditation must comply with various standards, including maintaining valid licenses, adhering to applicable laws, and ensuring privacy and transparency, along with providing accurate contact information on their websites. They must also avoid significant or repetitive adverse actions, operate within approved jurisdictions, ensure prescriptions are valid, and ensure affiliates meet the same compliance standards. In 2024, the application fee was approximately $975, plus there is a $1,000 yearly fee for .pharmacy domain name registration. A website is not required, but a pharmacy domain name is. The domain name can be linked to LinkedIn or Facebook. The registration and renewal fee may be discounted through your pharmacy management software vendor, so ask questions that can save you money. Processing time can take up to 60 days or more, so be prepared. Additionally, Healthcare Merchant Accreditation is an annual program and does require yearly renewal. Healthcare Merchant Accreditation is also necessary for advertising on Google, Bing, Yahoo, Reddit, TikTok, Snapchat, and Twitter. It also fulfills Visa and MasterCard's certification and monitoring requirements for pharmacy merchants, card not present transactions, which are very common with medication deliveries. Let's talk about the Drug Supply Chain Security Act, or DSCSA. You've probably heard of it, but what does it actually mean for your pharmacy? The DSCSA was created to make sure that every prescription drug in the U.S. supply chain is safe and can be tracked from manufacturer to pharmacy. Think of it as a safety net. It helps prevent counterfeit or unsafe medications from reaching patients. So, who is responsible for this tracking? Manufacturers, repackagers, and wholesalers all have to properly label products, share tracking information with their trading partners, and verify product details when needed. And that is where GLNs, or global location numbers, come into play. A GLN is a unique address for your pharmacy in the supply chain. It tells trading partners exactly who you are and where your products are going. Having and sharing your GLN is key for things like managing saleable returns, and meeting DSCSA requirements. And here's something important: your suppliers will ask for your GLN on your applications, so it is a must have. Now, let's talk about product identifiers. Every medication needs a unique ID under DSCSA. That includes a GTIN, a barcode that contains the NDC, a serial number, a lot number, and an expiration date. This tracking system ensures pharmacies and suppliers can verify drugs before they reach patients. The cost of obtaining a GLN is approximately $30. The online application can be found at mygs1us.org. Now let's talk about the Health Industry Number, or HIN. If you are a pharmacy owner, this is something you will want to be familiar with. HIN is a standardized identifier used in the healthcare supply chain to track and recognize businesses like yours. It helps suppliers, distributors, and other trading partners accurately identify your pharmacy's location and activities. You can request one directly from HIBCC through their MyHIN portal. Once your account is set up, you can easily submit requests for new HINs or update existing ones. Now, here is why this matters. Many suppliers will ask for a DEA number when setting up an account. But if you're still waiting for your DEA certificate, some suppliers will accept your HIN number in the meantime. This can help you get started with purchasing and setting up accounts while you wait. So if you haven't looked into your HIN yet, now is the time to do it. It is a small step that can make a big difference in streamlining your pharmacy's operations. The initial fee is approximately $100 if obtained directly from HIBCC. The annual renewal is approximately $50. The pharmacy requirement is you must be open or opening within 30 days. For more information, visit HIBCC and select HIN application. Up next, city and county requirements for your pharmacy. These are essential for ensuring your business is properly registered and compliant with local regulations. First, you will need a certificate of occupancy. This comes from your city or county and confirms that your pharmacy's location is safe and meets zoning and building codes. You will typically need this before opening or making any structural changes to your space. Next is the certificate of use, which is required by both the city and county. This certificate verifies that your business is allowed to operate in its designated location and is being used as intended. Finally, there's a local business tax receipt, which is sometimes called a business license, and you will need one from both your city and county. It shows that you have registered with the local government and paid any required business taxes. It is important to check with your specific city and county offices as requirements can vary. Making sure you have all three of these documents in place will help you avoid delays and keep your pharmacy running smoothly. Before we wrap up, let's go over what you have gained from this lesson. First, you now understand the key licenses and permits required to operate a pharmacy at the state, federal, and local levels. Next, you have learned about the regulatory bodies that issue these licenses, including the Department of Health, DEA, NCPDP, NPPES, HIBCC, and local government agencies. You also recognize why these licenses matter. not just for compliance, but for billing, supplier relationships, and securing contracts with insurers and healthcare networks. We have reviewed associated fees and renewal requirements, ensuring you are both prepared for both initial applications and ongoing compliance. Finally, you understand that licensing and permitting are an evolving process. Regulations can change, so staying informed and conducting periodic research is essential to maintaining compliance and keeping your pharmacy operational. The next slides contain the module worksheets and call to action items, helping you take actionable steps to implement what you have learned. Let's put this knowledge into practice.